Hi guys, welcome back to my channel, and today I'll give you a quick review of chapter 9 of Oral Pathology and Oral Medicine book by Odell. The name of the chapter is Major Infections of Mouth and Face. So let's get started. So move on to facial or tissue space infections, normally not present formed when pus or exudate accumulate, when abscess migrate to soft tissue, when facial space formed. Normally these spaces cause spreading infections. Facial cellulitis. What is facial cellulitis? Facial cellulitis is a spreading disease and inflammatory exudate form in subcutaneous tissue. The main features are edema, fever, toxemia, diffuse swelling. Diffuse swelling is the most important characteristic, board like firmness. Now move on to Ludwig's angina. Ludwig's angina is the most important part for the OSPE point of view, or the clinical stuff also, what you call. Okay, so this is severe form of cellulitis. Arises when infections in lower, second or third molar. Involves sublingual, submental, submandibular space bilaterally. If these spaces bilaterally involved, leads to Ludwig's angina. And the main features are extremely painful brawny swelling on upper part of neck or floor of the mouth. The treatment is incision and drainage, and under antibiotic coverage. Complications are airway obstruction. To resolve this, we do incubation, and the treatment is aggressive antibiotic given like penicillins and pus drainage. If patient in very painful condition, we give general anesthesia and securing airway by tracheostomy. Now move on to antibiotic abscess. When the abscess is already treated, but not all microorganisms eliminated by antibiotic treatment, this abscess is called antibiotic abscess. This abscess is sterilized but not finished, also called antibioma. Increased level of antibiotic seen. Now move on to cavernous sinus thrombosis, which originates from upper anterior tooth when infection occur, and the path is infection from anterior teeth to canine space, then retrograde travel to eye, then to cavernous sinus, basically. Okay, now move on to treatment. Okay, not the treatment but the clinical features. Okay, so clinical features are increased eye exophthalmos, fixed pupil, dilate, limited eye movement, basically problems with the eyes. And the treatment are intravenous antibiotic, pus drainage under antibiotic coverage, causative teeth anterior to canine, immediately extracted. Okay, anterior canine immediately extracted. The main complications are meningitis and clotting in cerebral sinuses. Now move on to actinomycosis. Caused by actinomycosis Israeli, infection swelling in upper neck, angle of the jaw. Pain is minimal, so there's less pain. Diagnostic feature is sulfur granules seen. So sulfur granules are the diagnostic feature, and it also comes in your OSPE also. So you just need to remember this. And then we have management. In management, We do bacterial specimen and seen sulfur granules, as I told you before, and penicillin 4 to 6 week. If allergic to penicillin, then do erythromycin given. So that's all for the chapter 9. I hope you like this video. So please like, share and subscribe to my channel.